I'm Brianna. I'm going to be your nurse for today. How are you doing?
Haven't seen you here before.
I'm new, actually. I just moved here from New York. So how have you been?
Good as I can be, I guess.
Okay. Well, how often have you been doing dialysis?
I come 3 times a week.
Monday, Wednesday, Friday?
Yeah.
Okay. Well, I'm just going to assess you really quick, and then we'll go ahead and get started, okay?
Can we just, skip this whole part so we can get it over with faster? I just don't want to be here.
Is there a reason you don't want to be doing this?
Major depressive disorder is common among patients with end-stage renal disease and negatively affects physical outcomes. The depression rate reported in end-stage renal disease is 20% to 30% of adults receiving chronic hemodialysis in outpatient facilities. Patients with end-stage renal disease on chronic hemodialysis with both depression and anxiety have been found to be twice as likely to die or require hospitalization compared with those without depression. The odds of being non-adherent with medical therapy recommendations are 3 times greater in patients with depression compared to patients without depressive symptoms. Assessment, education, and treatment of depression in people on dialysis had the potential to improve outcomes and enhance quality of life.
So is there a reason that you don't want to be doing this?
Dialysis just takes a lot out of me. I'd rather be spending time at home doing things that I enjoy or spending time with my kids and my grandkids.
You have kids and grandkids?
I do. I have 3 boys and they both have 2 kids each.
Wow.
They're my life, and I can't even spend it with them.
Well, I'm sorry to hear that. We'll make it as fast as possible, but we're going to be spending some time with each other, so I'd really like to get to know your past medical history. Other than your
What else would you like to know?
Do you have any other diseases or conditions?
You name it, I got it all.
Okay, like what?
I have diabetes. I have congestive heart failure, history of hypertension. I've had 2 heart attacks, 2 strokes. Don't you have it all in your chart?
Well, yeah, just so I know and I hear it from you, I'd rather
I see
hear it. Yeah. So what kind of ways are you treating these? Are you taking medications at home, or how else do you treat it?
The point prevalence for depression in the general population is 2% to 10%. The depression rate in patients on dialysis is between 20% and 70%, with considerable variation due in part to the challenge of assessment and diagnosis in the context of other comorbid conditions. Found that 20% of patients on hemodialysis suffer from a major depressive episode at one point during their dialysis experience.
So Carissa, how are you managing your other conditions at home again?
Well, I'm supposed to be restricting fluids. Something like I can't have a lot of salt or added salt.
Okay. Yeah,
I'm
you're supposed to
monitor my glucose, but I don't really like those finger sticks that we do, so, you know.
I know, those are hard. So you know that you do limit your sodium, your phosphorus, your potassium, special diet that you need to follow. And you're right about the fluid restriction. And do you take certain pills for dialysis?
We're gonna be honest, I take probably 26 pills a day. Couldn't even tell you what they are, but they're for all of the above.
So Carissa, I've noticed you've been really bothered this session. Is there anything going on?
I just find it harder and harder to come 3 times a week. These sessions just drag on.
Are you sad about something?
I guess you could say that. I just contemplate if this is even worth it, if it's even worth living life anymore.
Have you ever thought about taking your own life?
It's been a thought before, but I don't think I could ever do that to my babies.
Well, I can talk to your provider and see if we should evaluate you for depression and possibly put you on some antidepressants.
I just don't think he'll care, but I guess it won't hurt to see.
Nurses can help to identify and treat depression in renal patients using Orum's nursing process. Orum's theory of self-care deficit
is one of 3 interrelated components of a single-grain theory of self-care. The theory of self-care deficit poses that a self-care demand occurs when a patient or family member are not able to provide care and identifies when nursing care is needed. The 3 steps are: 1. Determine why the patient requires care. 2. Design a nursing system to deliver the appropriate level of care necessary to a particular individual. Step 3. To manage the nursing system, which includes planning, initiating, and evaluation nursing actions.
Hi, Dr. Maurer.
Hey, Brianna, what can I do you for?
We have a patient in room 111 named Carissa.
Okay.
She's been having some hard time going through today's dialysis. She's acting really depressed, and I was wondering if we could get maybe a consult to have her evaluated, maybe put on antidepressants.
Ooh, that's gonna be a little hard. People on dialysis can't take antidepressant medications, knowing that they're excreted mostly through their liver and their kidneys. So with her being on dialysis, it's gonna be really hard on her kidneys. I don't think she's capable of being able to excrete those drugs.
Is there anything else we could try?
We can try some cognitive behavioral therapy, maybe. Maybe some education you can teach her.
Okay.
Things like that we can try first.
What exactly is cognitive behavioral therapy?
Cognitive behavioral therapy is a well-documented treatment option for patients with various psychiatric disorders, including anxiety and depression. Cognitive behavioral therapy attempts to eliminate depressive thought patterns and changes problematic behaviors through cognitive restructuring. The goal of this treatment strategy is to achieve a higher level of physical and emotional functioning by engaging the client in structured therapy sessions.
Nurses can assist with these changes related to dialysis by providing educational opportunities and advocating for strategies that can increase self-care support, thus making a positive impact on patient quality of life. The ability to identify and address psychosocial concerns in patients with end-stage renal disease may provide vital information to assist patients with self-management skills to improve adherence.
Practitioners recommend small doses of antidepressant drugs for patients on dialysis due to psychological safety concerns. The most widely used antidepressant in patients with end-stage renal disease are serotonin reuptake inhibitors, or SSRIs, and benzodiazepines for insomnia and anxiety-related symptoms. Hey, Carissa, it's Dr. Maurer here, your nephrologist. How you doing?
Doing okay.
What's wrong?
I just had to come in again. It's my 3rd day this week. I'm just over it.
Yep. Well, that's kind of how it goes with dialysis. 3 times a week, Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, that type of thing. Has your nurse been in to talk to you about how your cognitive therapy or anything went?
We briefly discussed it last week. She said we were gonna consult with you. I tried going, but I just don't think it's gonna work.
Why? What's going on? Did you have the psychiatrist come in and go through all that?
I met with a psychiatrist, and the way that she expressed how I need to change my cognitive thoughts just doesn't seem feasible, because how can one have a different attitude about dialysis? Like, it's not fun.
I completely understand. All right, and your nurse went over some education with you too, the last time you were in?
Just the normal stuff, like can't have a lot of fluids, can't have any added salt.
Yeah. All right, well, I really didn't want to put you on any antidepressant medications, but we can start you out on a really low dose of what we call an SSRI, or a serotonin reuptake inhibitor. We can try a really small dose there and see how you do with that. Would you like that?
I think that would work better than the cognitive behavioral therapy. I know it's a history in my family, and I'm pretty sure that's what my family's taken before.
Okay. Well, I just want you to be mindful that this medication is hard on your kidneys. I mean, let alone someone that has kidney disease to begin with. So I want you to understand all the symptoms and effects it can have on you.
Yeah, well, I'm already here, so let's just try it.
All right. You got it.
All right.
Individuals are often overwhelmed by their chronic disease and receive most of their care from nephrology specialists and primary care physicians. It is not unusual that these providers, due to time constraints or expertise, would be cautious in diagnosing and treating a mental health problem in a complex patient group. It is essential that medical professionals caring for this population are attentive to the signs and symptoms of depression and take appropriate actions to ensure timely mental health evaluation. It is suggested to integrate screening into routine patient care on admission and every 6 months after that due to the high prevalence of depression in end-stage renal disorder and the association of depression with poor outcomes.
The diagnosis of end-stage renal disease has long-term psychological effects, including depression, anxiety, fear, anger, and despair. Depression is often observed in patients with end-stage renal disease as a reaction to a potentially irreversible disease and the potential loss of health, lifestyle, and financial status. Depression is composed of 2 components, including affective, mood, and physical, somatic symptoms. Depression measurements may vary with the length of a time a patient has undergone treatment. The Diagnostic and Statistical Manual of Mental Disorders 5, also known as DSM-V, reports the diagnosis of major depressive disorder that requires a combination of mood and somatic symptoms for at least 2 weeks. Orum's theory of self-care deficit is appropriate for identifying depression, discovering motivation for change, and encouraging self-care practices.